Hi there, welcome to a presentation by CBH Education in our pharmacy revision series. Today we're going to be talking about penicillins. So in the penicillins group you have penicillins and you have cephalosporins. Now these antibiotics are used commonly throughout various indications, for example pneumonia, cellulitis, even long-term antibiotics. For example, in the treatment of splenectomy, patients are given phenoxymethylpenicillin. You'll also see them used in the prophylaxis of UTI infections as well. So with this group, you will come across a variety of antibiotics as mentioned, and what you've got to make sure you understand in this is how they work. So basically what they do is they inhibit the enzymes responsible for cross-linking peptidoglycans in the bacterial cell wall. So obviously this weakens the cell wall, which causes swelling, lysis, and death. Main side effect is gastrointestinal upset. Main drug interaction is with methotrexate, increasing the risk for toxicity. And the key monitoring is the side effects of long-term use as well. Patients using antibiotics long-term, you can get things like side effects over a specific period of time as well. Even short-term use as well, you can get side effects. So it's just making sure that the patients are counselled on this and understand what they need to look out for as well. Aspects to help you with your revision and what you may come across in clinical practice. So you've got antibiotic resistance. Now we've talked about antibiotic resistance and we're going to do a presentation about antibiotic resistance as well. But one thing that is really key is when you are checking for an infection, you've got to make sure that obviously you take, if there's a respiratory infection, a sputum sample, urine sample if it's for UTI, and obviously just to see what the antibiotic the microorganism is sensitive to as well. Now obviously with penicillins, especially amoxicillin, it is used as standby antibiotics in patients with COPD or an infective exacerbation of COPD as well. And you've got to make sure that you monitor that usage, which is really key. If patients are ordering antibiotics every single month and it's not indicated, it's really important that these are audited as well, because this is where the risk of resistance can happen as well. Again, long-term use as well. So depending on what speciality the patient is under, there can be a whole host of reasons why the antibiotic is prescribed. But one of the key things here is documenting in the notes, especially if you work in GP practice and you're reconciling a hospital discharge onto the patient's notes. It's identifying that indication for why that antibiotic is being used, how long are they going to be using it for, and when is it going to be reviewed as well. Also, patients have allergies to antibiotics, and one of the common themes that you will tend to find is a penicillin allergy. So a patient may be allergic to penicillins, they may have that crossover with cephalosporins as well. So it's again something what is really key before you even prescribe an antibiotic. Make sure you check the allergy status. Common mistakes happen when patients are allergic to penicillin are given something like amoxicillin, and then they do get a severe allergy to this as well, which can be detrimental, even life-threatening. Now, if a patient's starting an antibiotic new, one of the key things is that you need to counsel them on the signs and symptoms for looking for an allergy. So things like commonly like a rash, and then obviously the other symptoms associated with it as well. Documentation of an allergy is key. When you are doing your medical history, when you're doing the medicines reconciliation in a hospital, for example, it's making sure that you do check the patient's summary of care records, medical notes, clinic letters, identifying if they've had an allergy previously as well. You get something called degraded allergies that come onto GP systems, where a patient may have had a reaction to a drug 20 years ago, and sometimes it's just overridden, or even without looking at it as well. Again, to reiterate, in your OSCEs, you do not document an allergy, you're failing. It's simple as that. These red flag allergies need to be documented even before you ask. The first thing you do in an OSCE is, do you have any allergies? And one of the most common themes that will come up is allergies to drugs, especially like allergies to different antibiotics as well, not just the penicillin group as well. And even when patients do have allergies, it's really important that where they seek the medical advice from as well, that safety netting and where to refer them to onwards as well. Thank you very much for listening to this presentation by CBH Education. For further presentations on pharmacology, OTC medications, OTC conditions, the legal aspects of prescribing, OSCE revision, pre-registration exam questions. Please follow us on our Facebook, Instagram, and YouTube channel.